Do you wake up in the mornings with sharp pain in your heels, hobbling to get out of bed and get going for the day? Maybe you've tried new shoes, maybe you've tried stretching, maybe you've just tried resting it. If this is you, you know the frustration of plantar fasciitis. My name is Dr. Abby Robinson at Restore Chiropractic and Rehab in Lawrence, Kansas. Today we're going to dive into what plantar fasciitis is, why it doesn't go away on its own, how do we evaluate it in office, and what are some things that you can do starting today to help alleviate your pain. Let's dive in. So what is plantar fasciitis? Plantar fasciitis is an inflammation of the tissue on the bottom of the foot. There's something called the plantar fascia, and it goes from your heel all the way down to your toes. And that creates like a spring in your foot as you're walking and moving around. So when this tissue gets overloaded, then this tissue starts to get inflamed and starts to give you that pain. The most common presentation of plantar fasciitis is pain in the morning, first thing getting out of bed. So you might find yourself hobbling to get going for the day. You might have sharp pain right at the heel. You might have it right through the arch. Any of that is going to contribute to that overload of the plantar fascia. Then what also happens is your calf will typically get really tight. You may not necessarily notice this because of the pain that's happening through here, but this plantar fascia comes through here, attaches at the heel, and then there's tissue that comes across the back of the heel bone, the calcaneus. It goes into your Achilles and your gastroc muscle. So those two are very connected, even if we don't necessarily feel or notice that connection. One is going to affect the other. So if this is tight, this is going to get tight, and vice versa. Other things that can cause overload to this tissue here could be things like joint restriction, and that can be in the ankle, that can be in the forefoot, that can even be up in the lower back, the hip, or the knee. So we always want to look up the chain when we're talking about plantar fasciitis. Even though our pain is here, that is not necessarily where our problem or all of our problem is going to be at. Why does plantar fasciitis keep coming back? You have tried new shoes, you've tried resting, you've tried different exercises, and you're feeling better, and then you get back to activity and it comes right back. Well, again, we come back to this plantar fascia is overloaded. So these tissues are irritated, inflamed, angry. And so what happens is we start to favor that foot. And so we start to do things that avoid using the proper mechanics, the proper muscle activation in that foot, and then the whole chain through here. So then what happens is we start to decondition that foot without even realizing it. So then when you go back to the same activity you were doing, you're just not quite ready for it. That capacity is too much for you. So how are we going to address this in office? There's multiple things that we're going to look at. We're not looking at just where your pain is, because again, this is a puzzle. We've got to put it all the pieces back together. And it can be anywhere through this whole chain. So we're looking at the foot, the tissue itself. We're going to palpate through the tissue, make sure we're not finding any trigger points or tender points. The patient can communicate with me where she finds the tender points as I'm palpating, and then I will also correlate that with where I find a lot of tension in those tissues. We're going to do that same thing up through the calf. We're going to go up through the hip as well, make sure everything there is moving well as far as the tissue, the soft tissue. Then we're going to start looking at the joint mobility or joint mechanics. So is the ankle moving well? Is it stuck? Is it restricted? So we're going to look at the ankle itself. We're going to palpate and kind of motion the joint into dorsiflexion, make sure that we're not restricted that direction. We're going to look at the forefoot, make sure that all these joints of the forefoot are moving well. And if we find any of those restrictions, we can adjust for those. We're also going to watch you walk. One of the things that is really important is watching your gait pattern. So if there's a breakdown in gait, if you are supinating, if you're pronating too much in either of those directions, that can cause more strain on those tissues. And then lastly, we're going to look at functionality. So are there activities that you want to get back to or that you cannot do because of this discomfort? Something is breaking down or compensating during that activity if you're not able to do it. And so we're going to watch you do some of those activities or something close to your activity in order to see where that breakdown happens. And this also helps us when we're treating, because we can tailor your treatment plan as far as rehab goes to you as an individual and what activity is you're trying to get back to. Okay, so how do we treat for plantar fasciitis? Well, we have several different options. One is always going to be soft tissue. We talked about how we palpate before. We're definitely going to do that because we need to know which soft tissues are the most affected. So we can treat that using our instrument-assisted soft tissue. So we use our little metal tool here, and we come in, we take tension on the tissues, and then we're going to basically we'll call it scrape those tissues. So we're looking for any adhesions, anywhere that I feel more of that, I call it like a rocky road as I'm doing this motion. If I feel more of that, I'm going to concentrate in that area. Typically, I'm going to get some good feedback from the patient as well when I find those spots, because it's not the most comfortable. That is one way. We can also use our hands to do the same concept. So again, I'm going to find that same area of tension. So I'm going to take tension with my thumb here. I'm going to move that muscle or soft tissue by stretching it underneath my thumb. Again, feedback from the patient is handy here because it tells me I'm in the right spot typically. If those aren't quite cutting it, sometimes we will jump into what's called dry needling. So dry needling, we are going to do one of two things with this. We can, if it's very acute, very irritated, can't tolerate what I'm doing with my hands or with my tool, then we're going to come in with dry needling and just try to calm down the whole limb. Okay, so we've got different points, what are called homeostatic trigger points, and we're going to target those to get a global effect of calming things down. And once that happens, then we can get a little more aggressive with it, and we can go in where those trigger points are. I'm not typically going to put needles on the bottom of the foot because that's just mean, but we're going to put needles in the areas that feed that. So we talked about the calf muscle, the soleus muscles, the gastroc and soleus. Those two make up the calf. Those muscles, when they get really tight, again, they are pulling on the plantar fascia. So if I can get this to alleviate, that helps take tension and overload off of the plantar fascia itself. One other option that we have with treatment is this guy here. This is our shockwave machine. When we're using the shockwave, what it does is it helps to mimic load, number one, but it also helps to desensitize those tissues. So we talked about how this is overloaded, but it's also really sensitive. So those first few steps when you get up, or when you, after sitting for a long period of time, it's really sharp, really angry. This helps to calm that down so that you can do a little bit more each day after using this machine. And then one of the last things that we're going to do with treatment would be joint manipulation, and that is more of a manual adjustment again. So I'm going to come in here. If there was a restriction with dorsiflexion, we're going to give a little traction treatment. We can use a toggle board to adjust through the forefoot. We're going to make sure we look at the mechanics of the lower back and the hips and make sure that those are all moving well. Because again, if those things aren't moving well, that indicates that the soft tissue is also going to be strained. And then the last piece of the puzzle was, as far as treatment goes, is going to be functional rehab. So we're going to, again, go back to what it is that you cannot do or that you want to be able to do. And we're going to try to get you back to activity. To do that, we're going to build your rehab program based off of those things that you cannot do. So whether that is playing tennis, so a lot of like side to side movement, stop and go, we're going to work our way up to activities that mimic that so that you can build your strength back up and build your capacity back up.
Here are a couple of exercises you can start today to help with your plantar fasciitis. Starting in a seated position, you're going to put the arch of your foot on the ball, push down into the ball, and roll forward and backward through the arch. You don't want to go into the toes and you don't want to go directly on the heel, but between the two areas. And this will help to break up the adhesions or scar tissue or just tense tissue in the arch of the foot. Repeat this back and forth about 10 times. As that gets easier, then you can stand and again put more pressure into the arch of the foot on the ball and continue rolling back and forth. Now we are going to stretch the flexor hallucis longus. From a seated figure 4 position, you're going to grab the big toe, pull up into what is called dorsiflexion, and this will create a stretch along the bottom of the big toe and into the arch of the foot. Hold this position for 10 to 15 seconds. Relax, and then repeat. Doing this throughout the day will help with mobility of the first toe as well as the arch.
So if you're experiencing any of these symptoms and think that this might be something that we could help you with, give us a call today at 785-856-0825 and let's get you set up for an evaluation.